Good morning and welcome to today's show. I say good morning because I am here in the UK, but it is evening time for you on the other side of the world, Dr. Robin. And today we are here to talk about how to exclusively breastfeed, tips to make it happen. Hello, Dr. Robin. How are you today?
Hi, Chelsea. Lovely to see you again.
Yes, we always chat before the show, so it's a bit funny to say hello.
It's like we can reach out.
Oh, yes. Well, hello and welcome, everyone. Do get in touch whilst we are chatting today. We love to hear from you. Tell us where you're at. Tell us your situation. Are you pregnant? Are you breastfeeding? We really like to hear your stories. So, as I said, this is Dr. Robin Thompson. Dr. Robin has based her entire PhD research on why so many women experience painful breastfeeding complications. If you want to hear more about Dr. Robin's research or the Thompson method, do pop a comment below because I would love to share more. So, like I said, how to exclusively breastfeed. Dr. Robin, can you please, in your own marvelous words, tell us what you would say is exclusively breastfeeding?
Well, to begin with, it's understanding in pregnancy how milk production is made and how to avoid the most common complication, which is nipple trauma. And then, of course, following that is breast engorgement and mastitis. So they are the important things that came along with my research. And so exclusive breastfeeding begins with a mother with her baby, not everybody else with her baby. Where and whenever possible, her baby should be with her. Her and her baby are unique and they need to be together. And I always say we're the only mammals on the planet that let someone else take our babies, unless they're the animals in the zoo.
Very true. It does feel like a zoo sometimes, doesn't it?
Yeah. So I think that's the beginning point. The other really important beginning point is not cutting the cord, waiting for the placenta and the uterus to finish the work they need to do with the baby. And that's really important too. So that adds another dimension to heading towards exclusive breastfeeding.
Absolutely. And some of you may be wondering, well, that doesn't detail what is exclusively breastfeeding, but actually we would argue that it does, because exclusively breastfeeding is so much more than just what the meaning of it is. It's how you will accomplish it. And
Yes.
those first, that, pregnancy as well, we'll get into that in a moment. But like Dr. Robin said, that first breastfeed and that moment after giving birth will determine I suppose, your success towards being able to successfully breastfeed exclusively as well. So I'm glad we have spoke about that, because what I was about to say is, consider this, that what is being currently taught is actually not working. When you consider breastfeeding rates, world breastfeeding rates, and Dr. Robin's research, you spoke a lot about the decline, didn't you? The decline in initiation of breastfeeding to then having interruptions and also a lot of interventions in the first few hours following days and weeks with formula, bottles, and other things that really do contribute.
And no increase in breastfeeding rates. But one of the things that strikes me is if we could work with a mother during her pregnancy and she's feeling her baby, she's in tune. Only she knows. And what I talk about is ask the question, is your baby hiccuping? Because if the baby's hiccuping, it's drinking. It's already learning to drink in utero. So the worst thing we can do is to separate. And it's hiccuping to lay down fluid so that it's the first 3 days before the milk comes in, it's able to draw on interstitial fluid from the cells and it's also, for many other reasons too, without going into all the detail. But it is a very important point in pregnancy to know that the baby is hiccuping. And then, say the baby was breech or head down, we talk about different things.
You said that last week. It's very interesting. I went and watched the video.
How to create the best amniotic fluid drink for the baby.
Yeah, but how fascinating. And it's logical. Everything that you have included in your research, and many women that I speak to who have followed the principles of the Thompson method always say, it's just logic. It's just so simple and almost a bit why didn't we think of this before? But equally
Yeah.
mind-blowing, because it
Yeah.
all clicks in place, and it makes sense. So we're asking you today to consider that what is being taught is not working, and to look at world breastfeeding rates. How many women initiate breastfeeding and want to breastfeed and then are forced to quit before maybe they've even started, or in the early weeks before they want to? And many seem to think that actually world breastfeeding rates are low because of returning to work, because many countries don't allow lengthy periods of maternity leave, which I'm sure does contribute. But actually, and your research does show that the number one reason is pain. It's nipple trauma and pain, right?
Mm-hmm. Yes, that's right.
Which is
Absolutely
very sad.
right. And we've proven that time and time again with the way women, like when I do my fine tuning sessions, or women sitting on the couch with someone and just quietly watching, maybe talking her through a little bit of how to fine tune to have best oral cavity function that we can achieve for
Yeah,
that
so
little baby.
I remember the saving moment with you myself.
Yeah. And so when we can do that, when we can share the information of the craniocervical spine, the oral cavity, and the function of the oral cavity, the tongue muscle, the frenula in the mouth, and avoid cutting them, then we can talk more about how a mother can achieve her breastfeeding journey. And there might be some little things that stop her along the way, but primarily her baby is her baby, no one
Yeah.
else's baby.
And
Unless
actually, I think that when we work alongside these wonderful women, especially and particularly in the club, not so much in the rescue group, but particularly in the breastfeeding club, which is our support network, I think we really can see a huge difference for women that are prepared, or have access to the education during their pregnancy, which is what you just said. So let's talk about the next point here. So labour, birth, and breastfeeding are not disconnected. And actually, I should add on there, pregnancy, labour, birth, and breastfeeding are
Yeah.
not
And
disconnected.
think about it,
So
from conception to the birth of the baby, to the first hours, to the first days, to the first week, are transitions for the mother and her baby. They're not separate. We talk about pregnancy being separate from the onset and the progress of labour. That's not so. It's a progress that's unique to that mother and her baby, and often based on the genetic background. So if we think about it as a transition that's normal for that mother and that baby, of course there'll be reasons why things don't go the way they should, or the way they were expected. But you can't ever expect 100% guarantee, and nobody can. But if the least intervention we do, the more likely that mother is to enjoy the special moments with her baby without other people interfering. There's nothing urgent at birth unless the baby's APGAR score is less than 7, and then the baby may need some help, and those professionals know how to help the baby. They know what
and
to
it
do
is
without
it's
telling them.
very interesting how, now that I know, it is very, like I said, it's very logical. But before, and with giving birth and preparing and writing up my birth plan with Jacob, just over 2 years ago, I was constantly told to be flexible. And we're going to talk a little bit more about the birth plan in a moment. But I didn't actually understand how the decisions I made during labour and the birth would sometimes so negatively impact my first breastfeed, which then, of course, has a bit of a domino effect afterwards. It's what you call the cascade of interventions, right? And I think having access to education during pregnancy really helps me this time around, and many thousands of women who have been successful from the start, because they're able to make decisions, informed decisions from the very beginning. And even if they are having to make a decision where they will need opiates or other interventions because of X reason, personal reason, whatever else, it's their choice, they know how to be prepared for that. So I think what you're saying really resonates with me and
Yeah.
everyone, because it's true.
And there are other ways of not having opiates too, depending on the circumstances. They can have sterile water bleb injections, which then block the pain pathway. But again, they're not encouraged, because that doesn't mean there's control of the mother then.
And they're cheap.
Yes, and
Cheaper.
also the opiates actually affect the baby. And we who are working with women from birth all the way through to, whenever the women need to be assisted or encouraged, then we see the baby's behaviour. We know what's going on. The mother knows even before us. She gives us a lot of the clues. And if I hadn't have been involved in 25 years of birthing at home with wonderful women, I don't think my experiences would have been, or my knowledge would never have been as wise as it is now. So I think I've reached the experienced knowledge, and now I'm at the wisdom stage.
The wisdom stage. You certainly are, and you're sharing that,
Yeah,
sharing that with us all.
yeah.
Yeah, I think the fact that you have, the unique perspective of both working alongside women and birthing at hospital and at home is really what kick-started the entire Thompson method, I suppose. Your research, your knowledge, your wisdom, as you say, because you can see such a difference, and that is linked to the interventions, I would say.
Mm. And when you're privileged like me to see women who are having these horrific complications coming out of hospital, you have to ask questions. You can't just sit there and say, oh, well, this is what happens. You have to know why this is happening. So that was how it all started, wanting to know why. And it took a little bit of time to gather up everything I needed to be able to understand it. It took lots of discussion with other people who were interested in what I was doing, and lots of encouragement from experts in say, the craniocervical spine, the nuchal ligament, experts like my professors who taught me how to write.
Unlikely.
How to present my thesis.
Research is very, very difficult, and
Yeah,
your research thesis is very detailed, and I should imagine
I
that
was
was
never
not
planning
very
to do
easy.
anything like that. I was encouraged. So my role in my profession is to encourage, not to tell people what to do, how to do it, to make suggestions that might work for them, because I have the absolute privilege of working with a mother one-on-one almost all of the time. So that gives me so much information with her voice, with her facial expression, with her body, watching shape, size, and watching how she works. That gives me an amazing amount of information.
And I'm
Mm.
sure if any of our rescue group members or even club members are watching, they can really relate to what Dr. Robin just said, because we really do feel that you almost feel privileged to be in our time, as we equally do with you. And I know just after one session with yourself, I was in a complete different place. It turned everything around for me, and it saved my breastfeeding journey. I just really regret, it's my only regret, not taking the jump and investing in my breastfeeding journey from the start, because I honestly, truly believe I would have had a pretty perfect breastfeeding journey from the start if I hadn't have had those forceful interventions in those hours following birth. So I do love talking about the connection and the transition, as you call it, between
Mm.
labour and birth, because it's very
Mm.
beautiful and very true. So
Thank
I
you.
want to go into the 3 golden hours. Now, if you're interested in learning more about 3 golden hours, we have lots of very informative videos. We have a wonderful blog, and we have lots of other resources floating about. And if you want to really get into detail and be fully prepared for that first breastfeed, I would love to share more about Dr. Robin's online education. There's an entire module based on the hold your hands, walk through the 3 golden hours, and it's about understanding how your body works to produce that precious liquid gold, and that helps you then to have confidence in your body and your baby. And it also gives you the ability to make informed decisions. Like Dr. Robin says, each time we speak, how important that is, because it's your choice, it's your baby, your body, and your choice. So the 3 golden hours then, Robin, are the first breastfeed, right?
Yes,
Uninterrupted.
it's the transition of colostrum to the baby's stomach to prepare the baby's gastrointestinal system for the future and immediate and the future. And it's the rich, precious gold that the baby transfers. So it's another transition. So when the baby's born, it transitions to learn to drink. When it learns to drink later, it transitions to learn to eat. And then when it's eating and it's teething, it transitions to learn to chew.
Such a
So
fun time, lots of mess, lots
yeah,
of
so
fighting.
continuous transitions does this little baby and the mother go through. And, right through till, even the transitions are hard when they leave home. Yeah.
It never stops. You
No,
think
it
you
never
think when they're
stops.
newborn, you think it's going to get easier. Then they're
Yeah.
toddlers. You wish for the newborn.
So
It's
the
a
3 golden hours is very important to breastfeeding and very important to other people not handling the baby during that time. Certainly not for routine procedures. If a baby's APCAR is less than 7, that may well be expected. But it depends on the circumstances, the mother's history, a whole lot of factors. And in the moment, it depends on how the baby is as well. So again, you don't make absolute statements. You just talk about the suggestions and how things might be. But I believe the baby needs that time, and I've proven that over time, because the first part generally is just them smelling, tasting, touching, moving, feeling wonderful with mum. And mum, that the same feeling that's welling in the mother and the partner beside her too. There's all these beautiful moments in time that you need to have that time together to be able to experience how it makes you feel. It makes you feel wonderful. So the 3 golden hours is based on time for the mother and the baby, time for the baby to use its sensory skills and activate breastfeeding, and all its reflexes for survival. So when you watch the newborn baby, it is really based on survival. The baby is ready to go to survive. So then the baby feeds when it does, and that might take the baby half an hour to an hour to make its way to the breast if it's not too sleepy with opiates. It will take, in many cases, that time. Sometimes it'll be quicker, sometimes it'll be a bit longer. And then feeding from both breasts leisurely and swapping sides
beautiful.
and swapping sides. So we bring that colostrum down, and then there's a sleep period, a transition to a rest period generally.
Another transition,
Yeah,
another gentle, beautiful
yeah.
transition. I actually spoke to a wonderful mother last week, Robin. You'll be very thrilled to hear. Yeah, another wonderful 3 golden hours story from one of our club members, and she said that this was her fourth baby, and she was unsuccessful. This is her words: unsuccessful in breastfeeding previously. And this time she'd really enjoyed it because she just took control of everything. And she said, and even the thought of not being able to achieve those 3 golden hours didn't scare me because I knew there was a plan in place. I had all this information, these resources, and I knew what to do.
Mm,
And she said to me that understanding what the ABCAR score is, and that if
mm.
baby is 7 or above, that the baby is allowed to be with me, understanding that alone was a game changer for her. So if anyone's watching, I can see a few comments coming. If anyone's watching and wondering about achieving the 3 golden hours, and if you can't, or how you know you're allowed to. Allowed to is something that I hear a lot as well, which is quite scary,
You
isn't it?
are allowed to. There must be consent unless it's an absolute emergency, and then the senior obstetrician will make the decisions, not the young doctors, the senior obstetrician. But,
Yes.
you know,
And I
it,
think
it's,
understanding the APGAR score is actually
yeah.
key to that, because there's no reason why they should be taking away babies with an APGAR score 7, 8, 9s. So what we'll do is, if you do want to learn more about the APGAR score, Dr. Robin has shared and created a really wonderful, informative document, a PDF that we will share with you. So just comment APGAR score below if you'd like to learn more about that, and anything else that you've heard us talk about today. And
Yeah.
and actually, Sierra, I'll connect with you personally after we finish filming, talking about C-section and 3 golden hours. Robin, she's asking about that, so I'll share some information with her as well.
Wonderful. Thank you.
Thank you, Sierra, and thank you to Teresa as well. Here you go, Robin. We love these, don't we? We love these. We love these. Absolutely right. I saw that for 20 years as a paediatric nurse and UNICEF breastfeeding consultant. I experienced that twice, and after 18 years, I had breast issues. I love your work, she said. It's just
Thank you,
so very
Therese.
common, isn't it?
Teresa, thank you.
Very common
Grazie.
indeed. So let's talk about the birth and breastfeeding plan, because I think it fits in quite nicely to everything we've touched upon today. And I want to share with you, we've done other sessions on more detailed discussion on this, but today I just want to share a comment that I have seen so many times in recent weeks.
Mm-hmm.
But this particular comment, I just felt compelled to share it and discuss it with you. But my doctor said there is no point in having a birth plan because things don't go to plan anyway. There you go. I'll leave it there.
Wow.
I'll let you.
So that means a mother can't
What would you say to
plan what
that?
she wants to do. Now, was that a male or a female doctor? Because that's not reasonable. And we are supposed to be reasonable and accountable for our actions as well. So if a mother chooses to talk about how she sees her birth taking place, her pregnancy, her labour, her birth, the transitions taking place, she has a right to do that. And the responsibility of us, the professionals, to sit and sit. See, I say sit, not stand over, but sit in a comfortable place and talk with her about what she sees her journey will be. And then doing everything possible to help her make that journey real for her. And that's a responsibility. We should do that. Of course, when things deviate, then we rethink and we do that together, but we have an understanding of that during our conversation. We know that if things do deviate, there'll be, someone to help depending on the circumstances. And none of us can really predict. No one can predict. No one can give 100% guarantee. But the important thing is we do not go out to cause harm. That's very important. However, I do think we need to sit down beside and talk with women more and not say that it won't work, because mainly it doesn't work because of the cascading intervention.
Yes.
And
this is what I found interesting about this comment. As soon as I saw it, the first question that popped into my head was, well, I suppose the first thing I noticed was how definitive that was. Things never go to plan, it almost seems like he or she
no, and the doctor
was
has to
telling
plan
her.
for the woman, not the woman that planned for her birth.
Yeah, and it seemed almost you're not going to have control. That's what this poor lovely
Yes,
mama
that's
was being
right.
told.
Yeah.
And I just felt like it was almost unfair that before
Mm,
she's even experienced, she was a first-time mum, so she really does not, and I remember it so well, she does not know what to expect in
mm.
terms of the actual experience, physically, emotionally, but within the environment as well. She just
Yes.
does not
Yeah.
know what to expect. And I spoke with her, and we discussed the cascade of interventions, and going back to the APGAR score again, which is very helpful. And she's actually joined into the club, and she's already exploring the resources, and she's already actually quite shocked at how many women are just kindly and gently saying no thank you,
Mm.
and
Yes.
actually I've learned since, and from watching your video surrounding your birth plan template and the resources you've provided for us to create our own unique plan, I've actually learned that we're in a position, even if things don't go to plan, to still be in control, because we can, like you say, sit
Yeah.
down, discuss our preferences, discuss what happens in a case of emergency, and
Mm-hmm.
otherwise let them know that as soon as possible, I'd like baby to be here or wherever mum and doctor or midwife have discussed it. And it changes the game, I think, for women to know that they are in control. It's their body and their
Yeah,
baby.
that's right. Yeah, and the baby needs to smell and touch the mother. The mother needs to smell and touch her baby. She has carried this baby. It is her baby. And as much as possible, we should make that absolutely our first goal.
Yeah. And we've
Obviously,
just had a lovely comment from Lauren. I recognise your name, Lauren. Hi. It's lovely to hear from you. She said there's actually a section in the programme where Dr. Robin talks about what to do in the event of mother-baby separation. There's lots of resources on this. There's a lovely piece written by Dr. Robin, her own words, and it's Dr. Robin explains ... what to do in the case of mother-baby separation. And there are lots of resources and lots of beautiful, reassuring success stories as well. So please don't feel disheartened, but you consider that preparation is absolutely key for breastfeeding success. So
and
thank you for reaching out, Lauren. Thank you so much.
yeah, and understanding the first breastfeed is very, very important, and making sure that nobody else handles the baby during that time. Because
Yeah.
if the baby is forcefully pushed to the breast, then that's when the complications begin. So all of those factors are so important to that mother and her baby.
Yeah, and I think that additionally, the first breastfeed and what actually contributes to achieving that is understanding, knowing, and exercising your rights.
Yeah.
That's why it's so important, right? So that you can be in control and make those informed decisions.
Mm.
So I think the most important thing myself and many women have taken away, you might agree, Lauren, is having access to this education, your wonderful self, your wisdom, Dr. Robin, and the just incredible, empowering team of women that are behind the Thompson Method community. I think it allows us to finally trust our instincts. Why is it so important to be able to really lock into that?
Instinctive knowledge is the best guide. Honestly, it is the best guide. Only the mother knows. She senses internally, she's aware. And then if we listen to her instincts, then she gives us much of the answers. And I can tell you that through my Q&A sessions. If I read the last paragraph first, there's the answer. But I go through reading what they've said in the order that they choose to
Yes.
respect what they've put. But if almost 98% of the time, there's the answer. She already knows.
Yes,
So
it's
if
very
we
true.
encourage her instinctive knowledge, then that makes life much easier for her too.
Yeah. And I think that a lot of external factors and fear mongering, unfortunately, doesn't help. But like I said, with the education, the knowledge, and the support of the wonderful team, we're able to take a moment to really just kick in and think, what's my gut telling me, I suppose, and looking at baby and working
Yeah.
together. So just to elaborate on our session, Dr. Robin, thank you so much, because this session has been very helpful. And I wish I'd seen something like this when I was pregnant with Jacob. But anyone watching, if you have any questions, do get in touch and I will connect with you. We have another live session coming next week, which is very closely related to today's session, and do catch our other sessions as well. We had a wonderful story last week with a beautiful mum who shared her finally, she said she's enjoying breastfeeding after 3 attempts. So that's very lovely. But so exclusively breastfeeding, for those that are asking, usually means or is understood as human breast milk alone, without adding, supplementing with non-human milk. Would you like to add anything to that, Robin?
Yes, because when you look at the mammal species that provide breast milk for their babies, their milk is specific. It's species specific. So can you imagine the human baby drinking elephant milk or camel milk?
Yeah.
And it's just not proportionate for the tiny human baby. And then if you can imagine the mouse trying to drink the elephant milk or even the human milk. So when I say species specific, that's quite documented in the research. And so that our little babies, our human babies, are meant to have the maternal milk. That's what's designed for them. The maternal body, the baby helps initiate the increase in volume in the first 3 days, and then the baby helps regulate that volume, which is quite high.
It's very magic, isn't it?
For survival. It's up high for survival after about the 3rd, 4th day.
And I think the thing that I always loved most about your work before I even joined what is it's an absolute dream to be a part of this, but the thing that I always was very drawn to is that you are a big expresser, let's say, of how it's a woman's choice. If you choose to breastfeed, if that's what you want to do, then there should be no one there taking that away from you, and there should be no circumstances in which are forced upon you. Formula being forced in the early days, because of there's so many reasons that some women are being told.
Yeah.
But of course, if you don't choose to breastfeed, that's different. That's not what we're discussing today.
No. And we do support a mother who does need to feed her baby other milk. We always support them. And we talk about how they can calm the digestive system, lots of other things as well. But simulate how the baby would work at the breast if it was working at the breast. We do that. Nobody's excluded. However, we're talking today about exclusive breastfeeding.
Exactly.
And you know, our bodies are designed to achieve that. Our babies' faces are designed to achieve that. Our bodies are just perfect, and so are our babies. What happens is there's so many negatives about, oh no, you've got flat nipples, you've got you know, you've got your breasts are too big, or your breasts are too.
I couldn't breastfeed, so you won't be able to.
Or your breasts
there
are too
so
small,
many.
you'll never be able to breastfeed. Well, it's not the way to give the mother the best possible chance to achieve what she needs to achieve. So I try to keep the negatives out of it and create the positives, and to encourage her to do what she needs to do, not what I want her to do, but what she needs to do, and look at her as an individual, very unique, genetically unique. She's different to every other mother on the planet. Genetically, biophysiologically, psychologically, neurologically, anatomically different. You know, it's not something that we can make set statements about. It's all about that mother and her baby. And if it's her third or a fourth baby, it's about that baby. You know, it's
I'm sure the wonderful Kelly could, her story definitely backs that up, I think.
Yeah.
Breastfed 5 babies. Baby number 6 she really struggled with. I'll
That's
pop
right.
her story at
Yeah.
her as well. So yes, if you're watching, we hope that we have helped you take a step on the path towards feeling like you are more confident, and do reach out so that we can connect you with, I can connect you with you personally and share some more information on Dr. Robin's online education, so that you can be fully prepared for any scenario and your unique journey that you're about to embark on. How very exciting. And we hope that watching this has helped you realize that breastfeeding is possible for you. It's absolutely possible. So congratulations on your pregnancy if you are pregnant, or your new baby, or anywhere along your journey where you are. Thank you so much for watching. Robin,
and of course, can I just add to that? It's possible for most women. There are women in my experience that have congenital abnormalities. There are women who've had serious things happen to. But, you know, again, we still help those women. We don't, you know, tell them that it depends on those unique circumstances. So
yes,
my
we're
experience is very diverse.
Unique women. Very important.
Yeah. Okay.
See, we're inclusive here. We're doing as much as we can to make sure that everyone feels like they have a chance at achieving their own unique goal, because everyone's goals are so different.
Absolutely.
But thank you so much for once again sharing your wisdom, knowledge, and time, because we know you're so busy. And yes, we just want to make sure that everyone realizes that, as Dr. Robin showed me, it's our baby, our body, and it's our journey. So thank you all. And we will see you back here next week at the same time to continue this session. So thank you so much, everyone, and take care.
Thank you, lovely Chelsea. Thank you.
Thank you. Thank you, Dr. Robin.
Take care.